To one of our RHDA evening seminars. We've had a number of seminars around the country that are always very well attended, and it's great to see you here during the evening. We have some great speakers this evening. Of note is a family that is a whole family that's joining us this evening, who's come across from Paul's Gap, and we're really looking forward to listening to their presentations about the impact that acute rheumatic fever, rheumatic heart disease has on them from a patient and family perspective. A few housekeeping things as always. Now, I'm not going to ask you to actually put away your phone this evening, but I am going to ask you to turn it to silent. The reason you're not going to put away your phone is because if you have a moment where you're tuning out, you might want to go to our website and download the RHD app. So keep your phone handy, put it to silent, and we'll talk you through where to find the guidelines and the apps. A couple of other things. If you registered online, you would have received a badge for this evening. It's been scanned into the system, and you will receive a follow-up certificate that has accredited CPD points. Please remember to pick up the certificates as you leave this evening. For those of you who are participating via video conference, we can arrange for your certificates to be sent to you. There will also be evaluations at the closure of the seminar within the next 48 hours. They'll be available to do online, and we really encourage you to provide us with feedback so that we can tailor the seminars to future needs. I would like to start by thanking the traditional owners and acknowledging those and the custodians of the land on which we are meeting today. I'd like to pay my respect to the elders, past and present, and also to the Aboriginal and Torres Strait Islander people who are meeting in this venue tonight, and to again acknowledge and thank the McAdams family for making a big journey across from Kununurra. So a quick quiz to get you all engaged and open in the space. Who lives or works remotely? Just a bit higher in the hands. There's a fair proportion. Who's seen a case of acute rheumatic fever? Who knows now that they've seen a case of acute rheumatic fever and might have missed it in the early stages? You don't have to put your hand up to that one, but maybe there's been a change in your thinking and your early intervention and diagnostic skills. Who's given a shot of BPG? And who knows how to prevent rheumatic heart disease? Only a few? Well, that's good, because by the end of this evening, we're hoping that you're all suitably enlightened and you do know how to prevent and detect and manage cases of acute rheumatic fever and rheumatic heart disease. And so if you do suspect a case of ARF or RHD, who do you know who to refer to? Do you know where to go to? Who's aware of the national guidelines? So again, by the end of the evening, I hope 100% can put their hands up and know where to find the ARF, RHD national guidelines. Who's downloaded the app? Hopefully that's frontline clinicians. Good. Our speakers have. That's really important. And who subscribes to Murmur or the online forum? A few people, and hopefully a few more by the end of the evening. Now, because it's a mixed audience of different disciplines and different levels of knowledge around ARF and RHD, I'm just going to quickly run through some facts around ARF and RHD. It's a disease that mostly affects children 6 to 14 years of age, and the majority are female. It's frequently caused by upper respiratory group A strep infections and also potentially group A strep infections from skin. And Steve Tong's going to be providing a presentation on that, and I think also Dana, one of the speakers this evening, may also touch on that with regard to one disease at a time, potentially. Rheumatic heart disease affects approximately 20 million people worldwide and causes up to 490,000 deaths per annum. Timely diagnosis of ARF and subsequent use of antibiotic prophylaxis, BPG, is the best method of preventing RHD. And I just want to reiterate, ARF is entirely preventable. If we address the risk factors, we will no longer see cases of ARF. So for those of you who are not that familiar with ARF, it's an illness that's caused by a reaction to a bacterial infection of group A strep, which can affect the heart, joints, brain and skin. It can cause joint pain, lead to hospitalisation, and it can be prevented. These are slides that I have borrowed from a colleague at Menzies, Melita, who uses these as an educational opportunity for enrolling people into the genetics study. They're not in a flat format. She provides it on an iPad, and you can interact with each of these little icons. They will do something and make some noises. What is rheumatic heart disease? Well, after events of acute rheumatic fever, the heart valves are stretched and may be scarred. The blood can't flow properly, and the damage occurs in frequency, can be more severe following each episode of ARF. Now, most of the audience would be familiar with the stats around RHD. That's a big concern for Aboriginal and Torres Strait Islander people, and that the Northern Territory has the highest rate of ARF in Australia and one of the highest rates in the world, with 58% of cases occurring between 5 to 14-year-olds. So there's a number of speakers that will be talking this evening addressing prevention of ARF and also management of RHD across an ARF-RHD pathway, focusing on the primordial aspects, what we can do to prevent it, through to the tertiary and the surgical interventions. And the impact, and some of you today have seen this small clip, but I'm going to show it again. I know there is some members of the audience, but I think it's a goodie, and it certainly sets the scene when we discuss the impact that it has on patients and their families. So this film was produced and directed by Moonshine Movies. It was over a period of months. The filming began actually in Cape Town, and Bo Rameni, who many of you would know, paediatric cardiologist sitting up the front this evening, has been instrumental in bringing the stories of these children to this medium so that we can share that with you, but also in any other audiences. That we participated in Barunga Festival recently, not the festival per se, but on the periphery we showed that segments of the Take Heart DVD, and to see the audience participation and reaction to that was very moving. Rheumatic heart disease is a central condition of poverty and of health inequality. Its persistent marks the failure of our health systems to address the non-communicable diseases of the poor. And based on the WHO Alma Ata Declaration, if we look at a social approach to human rights framework, if we look at those social determinants of health and how that plays out in ARF and RHD, we would understand that no matter how idyllic your setting, that there is a number of these factors that apply. Stress in communities, social exclusion, availability of healthy food, social support networks, and importantly for remote communities, how do they access effective treatment? And there's a number of things that we can do in this space around primordial prevention. It includes healthy housing. But for those of you who are working remotely, particularly the remote area nurses and midwives, If you can remember to focus on the early detection of treatment and of skin sores, follow the CARPA manual or PCCM if you're in another state, and ensure that you are accurately following up those cases. So with regard to RHD and our background, RHD Australia was formed in 2012 as part of a Commonwealth initiative around the rheumatic fever strategy. The overall program aims is to support the jurisdictional programs, of which there's several representatives, if not all, from the NT-RHD program here this evening, to establish data collection systems and to disseminate evidence-based practice guidelines, and overall to increase awareness in communities. And we aim to do this wherever possible using a One Health approach, where we work with one disease at a time. We've had initial discussions about how we might be able to work in partnership and deliver consistent messages across a One Health spectrum rather than looking at ARF and RHD in isolation. Also working with Trachoma and Indigenous Eye Health, Cape York Institute and Commonwealth departments. And I just want to note several of these partnerships and initiatives that RHDA is working on with respect to how we can further aim to prevent, detect, treat ARF and RHD, and the development of a SONG, a series of national guidelines specifically around RHD. The development of an RHD nurse practitioner framework is very exciting. It's the first time that we're actually aware that there is such a role that's being examined in Australia and certainly internationally. We're also working with 12170 to review data and look at the applicability of those findings in a local setting. And we have worked with World Heart Federation and REACH in hosting the World Congress of Cardiology Forum Dinner, where Kenny McAdam, one of our speakers tonight, gave an excellent presentation during our forum dinner and really drove the message home. We're also involved with the Better Cardiac Care Forum through ARMAC, the Australian Health Ministers Advisory Council. We're currently examining the efficacy of a portable echo project through our philanthropic trust funding, and we're in the process of developing an educational DVD around the administration of BPG. We do know there's a number of important gaps in our data around ARF and RHD, and it's really important that we continue to work with partners, including AMOS and Pregnancy Study, that has highlighted to us a number of gaps that we have in our data and how we might move to respond to some of their findings. So the guidelines now, some of you may have seen a media release today around the new suite of modules that have been developed for clinicians by clinicians. The clinician modules are aimed to improve and track and evaluate education programs, to develop further awareness. This is the release today that went out. And it covers a spectrum of clinician modules. Now, it's not for general health workers, it is for senior clinicians, senior nurses. And I just highlight to you that there's one there in pregnancy in RHD. These modules are self-guided. Each one takes about 45 minutes. At the end of it, there are CPD points that are allocated, and they're quite complex in the detail of information that's being provided to you. There is other education and training resources, of which we have 5. Can I just have an indication of those that have done the 5 online learning modules, the new ones? Sorry, not the new ones, the older ones. A handful of people. So if you can put that on your to-do list when you go back to your clinics, your health settings, have a look at those 5 online learning modules. Also have a look at the new 15 ones that we're launching this evening. And I just wanted to touch on some of the good work that's being undertaken at Menzies. There's the RHD secondary prophylaxis study, the RHD and genetics study, the AMOS one that I've touched on already, ARF and immunology, and the RHD echo screening program. And we also work quite closely with the coordinator of the WHF Pacific International RHD program. So welcome, thank you very much for joining us this evening, and we look forward to all the presenters giving us some really informative information tonight.